I'm joined by Dr. Joyce Locke from Southwestern Public Health. Thanks for checking in with us again, Dr. Locke.
Good to be with you.
Now, it's been 4 days since we had a new confirmed case in the region, and Ontario seems to be levelling off. Things are looking hopeful.
Yeah, we are very happy. When back in January, when we began to see COVID cases in Ontario, our biggest concern was that we would have another situation like China or Italy, but we haven't. With everybody's hard work at uh, good physical distancing, we really are in a much better spot than we had thought. So, yeah, things are looking good.
And I see the number of resolved cases has just surpassed the number of active cases. This must be good news.
It is as well. And as we said at the outset, 80% of people who get the COVID-19 infection get mild disease. And by mild means that they still can get a fairly bad flu, but they don't need to go to the hospital and they do get better. So the fact that we are showing the same thing locally with most of our cases resolving is a good news for all of us as well, reminding us that there's a really good chance if we do get it, we'll get better.
Now, your second weekly report came out on Monday. Are there any notable changes that we should know about?
Well, we did have a few more cases this week than the week before. So last week, I think we had 13 cases, and the week before it was 9. Why are we being still so optimistic? Well, we know that we are beginning to find more cases because we're testing a lot more, particularly in our healthcare settings, our long-term care homes and other healthcare workers. And all the cases that we have found are somehow related to healthcare settings. So they're either people who worked in the healthcare setting or people who were a family person or a contact of a healthcare worker. So we are seeing more cases. I don't think that means the disease is getting away from us. It means that we're picking up more cases.
Understand. Now, we've had some nice sunny days recently, and I see a lot more people out in the community. Do you think we're getting a little too relaxed?
I actually think people are taking this seriously, and I think we all need to get out. We've been cooped up all winter. It's wonderful springtime, one of the great times of year. So it's good to see people out as long as they still remember to keep the physical distance and to use the good hand hygiene. I do think people need to know that even though we've done a great job, we haven't had an Italy or a China here, the COVID virus is still in our environment and we need to keep up the good work. So it's all about trying to enjoy the outdoors and keep up the good work at the same time.
Gotcha. And on that note, let's say there's two families who haven't left their home, say for 2 weeks. They went for groceries, they haven't been out for 2 weeks, they haven't shown any symptoms. Is it safe for those two families to get together?
Now, what you just asked me about, not doing groceries, no symptoms, is what we call a risk assessment. So essentially, when you're going to spend some time with other people, you have to sit and think, is this safe or is this not safe? And what should I consider? So the example that you gave me of two families who have no risk because they did everything to keep themselves separate from everybody, they stayed in their own two bubbles, they're safe to get together. Because they're most likely not infected at all. But on the other hand, if you have, let's say, one family with two older people who have some health issues, and then they want to visit with their other family member where there's one person who goes out to work every day and is active in the community, they might have to look at it a bit differently. So I think if two families get together, you have to sort of think, is this safe? Who am I visiting? Where have I spent my day? Is there any chance that I picked up the virus from someone and will I spread it to someone I love? As long as you kind of use that common sense approach, then I think people can visit each other. But, be wise and also think, who am I visiting and am I going to be a risk to them?
Thanks. And we're just coming to the end of World Immunization Week. What should parents do if their children need vaccines?
Now, that's a really good question because that's one of the things that we have noticed has slipped. So we usually send out so many boxes of vaccine every few months. Well, we haven't been sending them out because doctors haven't been asking for them. So now we start to worry, maybe if people don't have their vaccines, we're going to get other diseases circulating in our community. So we have sent a communication to all our primary care providers to ensure that they keep vaccines and immunizations on their radar. And if you have children who need vaccines, definitely call your primary care provider and book the appointment and get them done. We're also looking at our school vaccine program because usually kids in grade 7 and 8 get vaccines at school, and schools are being closed for longer than we thought. So we're starting to put our head around how to solve that problem as well. So yes, people should remember not to forget their vaccines.
Gotcha. Any final thoughts today?
Just that we are hopeful. We're really happy where we are, but the COVID virus is going to stay with us. It's not going to go away, and most of us are still susceptible. So until we get a vaccine, even though the province is looking to opening things up, we all still got to be smart, wash our hands, and stay apart.
Okay. Thanks for your time, Doc Clark.
You take care. Bye-bye.
Bye.